While proper hydration is crucial for athletes, overhydration or water intoxication can be just as dangerous as dehydration. When too much water is consumed, it dilutes the body's sodium levels, leading to a potentially life-threatening condition called hyponatremia. For rugby players, coaches, and fitness professionals, it's important to understand the risks of overhydration and how to avoid it. Think of hydration like filling a fuel tank. If you overfill the tank, it spills and damages the engine. Similarly, overhydration disrupts the body's balance of electrolytes, particularly sodium, impairing both mental and physical performance. One of the main risks of overhydration is hyponatremia, where the sodium in your blood becomes too diluted. This can cause cells to swell, particularly in the brain, increasing intracranial pressure, which can lead to severe consequences like brain damage. Overloading the kidneys with too much water also puts unnecessary stress on them, impairing their function. The cardiovascular system is also at risk, as excess fluid can lead to heart strain. From a more everyday perspective, overhydration can result in gastrointestinal discomfort, causing bloating, nausea, and an unsettled stomach. Recognizing the symptoms of overhydration is key to preventing it from escalating. Headaches caused by increased pressure in the brain are one early sign. Nausea and vomiting, as well as confusion and disorientation, can follow as the body's electrolyte balance worsens. Muscle weakness and cramps are also common, as low sodium levels affect muscle function. In severe cases, overhydration can cause seizures and even loss of consciousness. So how can we prevent overhydration? The goal is balanced hydration, not too little, but not too much. Drinking in moderation and according to your body's needs is essential. One of the best ways to achieve this is by incorporating electrolyte solutions or sports drinks into hydration routines, especially during intense activity. These products help maintain sodium balance while preventing excessive water intake. Monitoring fluid consumption is crucial too. Keep track of how much water is consumed during training and matches, making sure not to overdo it. It's equally important to educate athletes about the risks of overhydration. Often, athletes believe the more they drink, the better. However, it's important to understand that drinking when thirsty and moderating intake is the best approach. Developing individualized hydration plans based on sweat rates and activity levels is another effective strategy. For instance, athletes who sweat heavily may need more electrolytes, while those in cooler conditions may not require as much fluid. Hydration guidelines can help establish a routine. Before exercise, athletes should drink 500–600 milliliters of water 2–3 hours ahead of time, avoiding large amounts right before activity. During exercise, small sips of water, around 150–250 milliliters every 15 to 20 minutes, can help maintain hydration without going overboard. After exercise, rehydration should be done gradually, aiming for 500 to 1,000 milliliters of water, balanced with electrolytes if needed. Daily intake should aim for around 2 to 3 liters, but this varies based on individual needs, so adjustments may be necessary. Monitoring hydration is key to preventing overhydration. Urine color is a simple but effective indicator. Light yellow suggests good hydration, while clear urine may indicate overhydration. Tracking body weight before and after training can also give insight into fluid balance, and noticing physical symptoms like bloating or headaches can signal the need to adjust hydration habits. Coaches and fitness professionals should regularly check in with players and make adjustments as needed. For example, a rugby player should balance water intake with electrolyte solutions during long, intense matches to avoid overhydration. A coach can educate the team on the risks, encouraging hydration protocols that use sports drinks instead of just water. Fitness professionals can tailor hydration plans to individual athletes, ensuring proper fluid balance without the risk of water overload. In conclusion, While hydration is critical, overhydration poses serious risks, including hyponatremia, cell swelling, and cardiovascular strain. The symptoms, like headaches, confusion, and muscle weakness, are warning signs that water intake has gone too far. Prevention starts with balanced hydration strategies, the use of electrolytes, and careful monitoring of fluid intake and physical signs. By implementing these measures, rugby players, coaches, and fitness professionals can ensure that hydration supports performance without endangering health.